Awareness Month. Probably not going to be telling you some things that you don't already know, but we're glad, first of all, to lend our support to the Western Pennsylvania chapter of the ALS Association. Since 1982, the ALS chapter in Western Pennsylvania is focused on research, providing help for people with ALS and their families in coordinating care. And at one point, I would say what ALS is. I'm going to try amyotrophic lateral sclerosis. Is that
A
it?
means negative, myo means muscle, trophic means wasting, and the lateral region of the spine.
Oh.
And you remember me from Take Your Kids to Work today, right?
And the statistics, quite frankly, are staggering. And if you don't know somebody impacted by ALS, it's likely that you will. There are an estimated 450,000 people living with this disease worldwide today, waiting for an effective treatment. And in the United States, a new person is diagnosed with ALS every 90 minutes. This month, approximately 500 people in the United States will be diagnosed with ALS. And ALS isn't a disease that really can strike anybody. It has no racial, ethnic, socioeconomic boundaries. Really anybody could be affected. People from their 20s to their 70s can be stricken with this disease. The good news is that there is hope. There are more than 150 potential treatments being looked at for ALS in the U.S. alone. In our own backyard, Pitt's Center for Research is working to integrate and coordinate the work that researchers and clinicians are doing on ALS and other motor neuron diseases. Pittsburgh on our own, or Pittsburgh also is part of a Walk to Defeat ALS, which helped to raise funds and awareness, as well as funds for the treatment. This year's event is being held on September the 7th in Point State Park, the ALS Association's biggest annual event. The walk raises, as I said, funds to raise for services and to support research. And we have a proclamation, and I think I'm going to present this to Babe. I think we're going to do this for Babe. So let me read this proclamation for those gathered here today. Whereas the month of May is recognized as Amyotrophic Lateral Sclerosis or Lou Gehrig's Disease Awareness Month, ALS is a neurodegenerative disease that usually attacks both the upper and lower motor neurons and causes degeneration throughout the brain and spinal cord, as you indicated. Whereas the cause of ALS is not completely understood, but it is known that it is a disease as a mutation of the SOD1 gene. Early symptoms include a painless weakness in hand, arm, foot, or leg, or difficulty with speech, swallowing, and walking. Whereas Mr. Lou Gehrig brought national and international attention to the disease in 1939 when he abruptly retired from baseball after being diagnosed with ALS. The disease mostly affects individuals between the ages of 40 to 70, and as many as 30,000 Americans have ALS at any given time. Whereas the ALS Association of Western Pennsylvania was founded in 1982 and provides services and support to persons living with ALS, caregivers, families, and healthcare providers in 31 counties. This nonprofit organization is involved in research, patient and community services, public education and advocacy, and a desire to bring help and hope to those facing the disease. Whereas Allegheny County is grateful for the work done by the ALS Association of Western Pennsylvania and for the outlet and resource it has been to our residents, many in our community depend on the services provided by the organizations, and we are extremely thankful for their continued and unmatched guidance. Now therefore be it resolved that I, Allegheny County Executive Rich Fitzgerald, by the virtue of the authority vested in me, do hereby proclaim May 2013 as ALS Awareness Month in Allegheny County. And we hope that this brings, again, more awareness, more support for a very difficult and very debilitating disease that affects so many. So I want to thank you for your advocacy. I want to thank you for your work, and certainly anything we can do in Allegheny County to support your endeavors, we want to do this. And I want to present this to Babe so she can have this here. And we will, I guess I should open this up. Oh, sure.